I'm Dr. Daisy Lund and I'm a GP living and working in London, but today I'm here in Wolverhampton to meet two GPs that are using lifestyle medicine in conjunction with their clinical practice. So Dr. Surabhika Lunawat and Dr. Mariam Malik are two GPs that have established Walk with a Doc here in Wolverhampton, and we're here to meet them today and walk with them. So I've got my trainers on, come and join us. Can you tell us a little bit about Walk with the Doc and how it all started?
Walk with the Doc is an organisation started by an American cardiologist called Dr. David Sabgir. He started it, I think, back in 2005. He recognised the preventative power of physical activity and movement, and he said he wanted to get his patients and his community up and about and moving. And now, almost 20 years later, there are, I think, over 500 or 600 chapters of Walk with a Doc all over the world. We're one of those chapters.
Amazing.
Yeah.
And how did you start your chapter or your group here in Wolverhampton?
I started the walk about 2 years ago, and it was very down and dirty, and we actually we printed leaflets out and we did door-to-door leafleting, got onto like a local radio station and spoke about it there.
Brilliant. And what sort of turnout do you get and how is it received?
The main ethos, as Dr. Surabhika said, is obviously physical activity outdoors. There's four key principles to Walk with a Doc. You've got exercise, physical activity, spending time in nature, social connection, and also the delivery of free health education as well. And so usually in our turnout, it's every other Saturday we have a walk arranged. We do the marketing now mostly online on a Facebook group and things like that, and an email list. And we have about, I would say, between 10 and 20 people each time, but we are hoping to expand even further now as time goes on.
That's wonderful. And how is it received in the community? What sort of feedback have you had?
We've had some incredible feedback, to be honest. We've had local councillors get involved as well. We've been to the Penn Residents Association kind of local community group. We have really good feedback from our kind of different service users, people of all ages. People are learning a lot from our kind of health education, making changes to their diet, exercise. People are becoming more active as well. And so we get people who are coming on a regular basis who are really excited for our walks.
That's brilliant. And obviously there's the health benefit, as you say, of regular exercise, which we know is so important. But what other benefits have you noticed patients are getting from this initiative?
Through that time, a lot of people who've been coming regularly, they form organically their own friendship groups. So that social connection element is a really, really big thread that runs through this walking group. But also what's happened is people from this group have got together and they've gone and joined other local walking groups. I think that sense of finding community and belonging is a really big thing, especially in the winter months.
What we found is that people from all sorts of different backgrounds attend our walk, from all walks of life, people of all ages, and people with various different health issues as well. And we find that they then get to connect with one another, and they might never have met each other or been able to have that connection were it not for the walks. And so we feel as if we're bringing together different people from different parts of the local community in a way that's not been done before in Wolverhampton.
But what about for yourselves as doctors? What do you get from this?
We get so much out of this ourselves. The learning that I get from preparing for the talks, for example, I'll definitely go and take it into my clinic room or into hospital, wherever I might be. All the benefits that you'd get from physical movement and being out in nature and being with people, we get that as well, the same as our walkers. So that's definitely part of it.
So does that pose a problem for you as a clinician, though, if you have a patient perhaps asking you a personal question on a walk?
Absolutely not, actually. People generally tend to respect our boundaries. It's like a professional, friendly relationship where they understand that we are still doctors running the walk. They also tend not to ask us for kind of specific medical advice, and we tend to tell them up front that I am a doctor, but I'm not your doctor. So we sort of set that boundary there, and what that's meant is that we can still continue to deliver health education without feeling under pressure that someone's coming to us about medical advice. It's all about teaching people about how to live life with the 6 pillars of lifestyle medicine in such a way that's really accessible and pragmatic, and it's really approachable information, basically. Having presented at the Pakistan Association of Lifestyle Medicine about the project that we're doing, and then managed to successfully set up the first ever walk in the history of Pakistan there for Walk with a Doc, it feels wonderful that we've been able to move that into a different country as well.
Has there been any funding or any support for you guys to do this sort of work?
Walk with a Doc is an international registered charity, and so a lot of what is done is on a voluntary basis. Any doctors that are interested in expanding it further can always ask for grants from the local council and things like that. So it's a possibility, but it's absolutely not a necessity.
Would you give any advice to anyone who's looking to start up their own Walk with a Doc or a similar sort of initiative?
I think the biggest piece of advice that I would give anybody trying to start anything, including these walks, is please just go for it, because it will always feel impossible until you make that first step. Once you've made that first initial step, it does usually fall into place somehow. There's so much technology available where you don't need to spend a penny. Yes, you do need to give up your time, but for us, like we've said, I think this is part of our purpose, our ikigai, doing this kind of thing and implementing lifestyle medicine into our daily practice. So it doesn't feel like a cost, it feels more like an investment. In terms of the practicalities, keep it as lean as possible. If you can advertise just purely on sort of social media, etc., that's all completely free and it's completely instant. So that's one way to do it.
To add to that, there are some little pragmatic tips as well for how to get started with Walk with a Doc. You just go on the website, so walkwithadoc.org. It's doc, not dog, because everyone seems to think it's dog. It's
yeah,
DOC, as in doctor. Set up an account there. You then become a walk leader, and then you have access to all of the information on the website, marketing. They already have ready-made posters. All you have to do is just find a location and get started.
I didn't know what to expect when I drove up to Wolverhampton today, but I've just been met by two fantastic doctors who are doing amazing things actually in their community. They're giving up their time, but they are getting back so much from it as well. And we met with a bunch of about 20 walkers, I think, and went on a beautiful walk. I mean, it's a great day today anyway, so we're very lucky with the weather. But they go ahead with their walks, come rain or shine. When we got back to the bowling club, which is where they use their headquarters, they gave a talk to everyone about the blue zones and about lifestyle medicine, and they answered questions from their community about what would be good to eat and what would be good to avoid. And it was really great to see them just chatting amongst their community and actually just highlighting the benefits of plant-based diet, of exercise, of nutrition, of sleep and stress management, all those things that we really want to do but perhaps don't have time in that 10-minute consultation. Well, they give up 2 mornings a month and they get the time to do that and really impart that knowledge and hopefully improve the health of their communities and their own health in the process. So it's been really great. I've really enjoyed my time here and I hope it inspires you to do something similar in your communities.